Our top story, COVID cases climbing across the country. Hospitalizations up more than 60% in the last month. A new projection showing over the next 4 weeks, daily hospital admissions will continue rising in nearly every state, including Utah, predicting about 5,300 more deaths from COVID over the next 2 weeks. ABC4's Nick McGurk asking doctors today about our state trends here. He's live at Intermountain Medical Center in Murray. Nick.
Hi, Glenda. Yeah, here at Intermountain, we had a chance to ask some questions about what's going on with long COVID, even as we asked what's going on with COVID cases in general. And based on sewage data, tracking the virus load throughout the sewage, we're learning more based on what other states in the country are experiencing and right here about what to expect, at least into June.
I did have the worst sore throat I've ever had. It felt like a hot branding iron was stuck down my throat.
1 week ago, Utah Governor Spencer Cox testing positive for COVID, and today, a warning from Intermountain Healthcare that the virus is now surging. A subvariant from Omicron, officials say, making up 40% of total coronavirus cases in the U.S. That's a spike from April when it was just 7%. And a new variant means your old immunity might not be enough to avoid illness.
If you were infected in December, that's 6 months ago. So with a different virus and 6 months having passed, your protection was pretty good in March, but it's not so good anymore.
Breakthrough infections are still possible even if vaccinated, but doctors say evidence is showing milder cases and less chances of long COVID if you're fully vaccinated.
Made it hard to eat, swallow, couldn't sleep because of the discomfort.
Governor Cox says he's vaccinated and boosted, though, an example of what's possible even as hospitals are still under strain.
We have a major staff shortage in all of our hospitals, and right now we're experiencing a lot of staff absenteeism due to people calling in with COVID. And that is really putting pressure on our ability to deliver care. And that's what I really worry about for the next 2 or 3 weeks.
So many people, of course, are talking about long COVID. Now, if you have a more severe case of COVID, chances are that you could be at a higher risk to get long COVID, according to authorities. Now, with kids, it's different. If you don't have a severe case of COVID, it's pretty irrelevant, they say. You could have a mild or asymptomatic child who gets COVID, who later suffers from long COVID. But doctors, they're really urging you to have some patience here. There's still a lot we're trying to learn about long COVID. We're live in Murray. I'm Nick McGurk, ABC4 News.